Okay, welcome back. This will be our last video in our lecture series on medical terminology. In this video, we'll cover chapter number 15, the endocrine system. Learning objectives for this chapter. Define and spell the word parts used to create terms for the endocrine system. Identify the major organs of the endocrine system and describe their structure and their function. Break down and define common medical terms used for symptoms, diseases, disorders, procedures, treatments, and devices associated with the system. Build medical terms from the word parts associated with the endocrine system. And lastly, pronounce and spell common medical terms associated with the endocrine system. I'll first talk about some anatomy and physiology for the endocrine system. We'll talk about some word parts, some common combining forms that you'll see. Adeno is a reference to a gland. Adreno is a reference to the adrenal glands. Crino is a reference to secreting. Gonado is a reference to the gonads. Hormono is a reference to a hormone. Pancreato is a reference to the pancreas. Reno is a reference to the kidney. And our last two, thyro and thyroido, both reference the same thing. They both reference the thyroid gland. Some basic information about the anatomy and physiology of the endocrine system. The endocrine system, along with the nervous system, is a major communication center for the body, and it controls multiple aspects of your day-to-day life by the secretion of hormones. And hormones are chemical messengers, and they're secreted by endocrine glands. And the whole point of all these glands, all these hormones, is to maintain homeostasis, and that term means having a stable internal environment. All right, this illustration, we have some of the endocrine glands that we have in our body. Starting up here in the brain, we have the hypothalamus, the pituitary gland, the pineal gland. You have the thyroid gland and the parathyroids next to it. You have the thymus, you have the adrenals, which sit on top of the kidneys, the pancreas. In the female, you have the ovaries, and for male, you have the testes. And throughout the system, the two biggest players are the pituitary gland, is known as the master gland, and the structure that controls that would be the hypothalamus. Alright, now we'll talk about some pathophysiology when it comes to the system. Now, diseases within the endocrine system can result from either the hyposecretion or the hypersecretion of hormones. You never want a hormone to be secreted either too much or too little. You always want to have a balance of what is needed. Now, hyposecretion can result from an injury or an infection, or from an inherited disorder or from a tumor. And hypersecretion may arise from an inherited disease or a tumor. Now, some terms that you will commonly see when it comes to pathophysiology with the endocrine system. The first one, syndrome. This is a group of symptoms that consistently appear with each other, and they characterize a particular abnormality or a particular disease. Endocrinology. This is the study of the endocrine system, and a person that specializes in this field of medicine would be an endocrinologist. All right, now we'll talk about some signs and symptoms of the system. We'll talk about the word parts at first. The prefixes. The first one, X, EX. This means away from or out. Poly means more than one. Some common combining forms that you'll see. Acido is a reference to acid. Acro means the extremities. Dipso means thirst. Hirsuto is a reference to hairy. Keto is a reference to ketones or acetones, which is a class of chemical compounds. Ophthalmo is a reference to the eyes. Some common suffixes you'll see. IA is a condition. Ism is a condition or a process. Megaly is the abnormal enlargement. Osis is an abnormal condition. S is a suffix that would make many terms plural. And urea is a reference to urination or the condition of urine. Alright, now we'll talk about some particular signs and symptoms of the system. The first one, acidosis. This is having an excessively acidic condition of the body fluids or tissues. Acromegaly, we're going to break down that term. Acro means extremities. Megaly means the abnormal enlargement of. This is the abnormal enlargement of an extremity. And our next term here, exophthalmos. This is a abnormal protrusion of the eyes. Right, this example, we have an illustration of acromegaly. This is showing the progression over a number of years. And you can see over time that the shape of this person's skull is becoming altered because the bones are becoming enlarged. This is acromegaly. So the jawline becomes much different. The brow becomes much different. The cheeks become much different. The bridge of the nose becomes different. In this illustration, we have an example of exophthalmos, where the eyeballs are actually protruding out of the skull. Our next one, goiter. This is a a swelling of the neck due to an enlargement of the thyroid gland. Hirsutism. This is an abnormal growth of hair on a person's face, especially in a female. And hirsutism is usually an indicator of another condition called adrenal virilism. And this is a syndrome where you have the development of male secondary sexual characteristics, often because of a tumor or some damage to the adrenal gland. So your next term, ketosis. This is a condition of having elevated levels of ketones in the body. This is often associated with the metabolism of fats and diabetes mellitus. Now, something related to ketosis is ketoacidosis. This is the elevated levels of ketones in the body, but it's caused by the lack of insulin in the body. And ketoacidosis can be life-threatening if not treated quickly. So your next term, polydipsia. This is having a abnormal amount of thirst, very common for people who have diabetes. And our last term here, polyuria. This is the production of a abnormally large volume of urine, and that urine will tend to be very dilute because there is so much of it. All right, now we'll talk about some diseases and disorders and their word parts. The first one, endo, means inside. Hyper means above. Hypo means below. Para means local or nearby. Some common combining forms you'll see. Adeno is a reference to a gland. Adreno is a reference to the adrenals. Calci or calso is a reference to calcium. Carcino is a reference to cancer. Crino or crino is a reference to a secretion. Glyco is a reference to a sugar. Gonado is a reference to the gonads. Mixo is a reference to mucus. Pancreato is a reference to the pancreas. Thyro or thyroido, both are a reference to the thyroid gland. Some common suffixes you'll see. Al means pertaining to. Emia means of the blood. Ism is a condition or a process. Itis means the inflammation of. Megaly means the abnormal enlargement. Oma is a reference to a tumor. Osis is a reference to a abnormal condition. Pathy is a reference to a disease. And pinia is a reference to a deficiency. All right, now we'll talk about some specific diseases and disorders. Our first one, adenocarcinoma. This is a malignant tumor that is found in the glandular structures, and more specifically is found in the lining of these glands. This will be related to our next term, adenoma, which is a benign tumor found in the glandular structures, in the lining of glandular structures. So adenocarcinoma is malignant, adenoma is benign. And we're going to break down that first term. Adeno refers to a gland. Carcino references cancer. Oma means tumor. A cancerous tumor within a gland. Adenocarcinoma. So our next term, adrenalitis, is the inflammation of either one or perhaps both of the adrenal glands. Now this happens, it can lead to, of course, several conditions. The first one being adrenal insufficiency, where the adrenals aren't making enough hormones, in particular cortisol. Now that condition is related to our next term, adrenal hyperplasia, but this condition is a genetic condition. Because of genetic defects, your adrenal glands are limited from making certain hormones, and the most commonly affected hormone is cortisol. Our next term, adrenomegaly, this is the abnormal enlargement of the adrenal glands. So our next term, congenital hypothyroidism, because the condition is congenital, is something that you are born with. This is a hereditary disease, and this is where your thyroid gland is underproducing hormones. And our next term, Cushing syndrome, is a very complex series of symptoms. What it really comes down to is your body is exposed to very high levels of cortisol for a very long time. And this can lead to hypertension or weakness, weak bones, or facial puffiness, weight gain, the stoppage of menstrual cycles for females. All right, this illustration we have an example of someone with Cushing syndrome. Another very common indicator of Cushing's is having a very rounded, mooned face, very reddened cheeks, a buildup of fat on top of the back near the neck, or it looks like a buffalo hump, thin legs and thin arms, a very poor wound healing. So all this is due to the exposure to cortisol at a very high level for a very long time. Our next two terms, diabetes insipidus, diabetes mellitus, are often confused with each other because they both have the name diabetes, but they're not related at all. First one, diabetes insipidus, or DI. This is caused by a deficiency in the hormone vasopressin, or antidiuretic hormone. This will cause excessive urination and extreme thirst. And diabetes mellitus, or DM, is what most people think of when you hear the term diabetes, type 1 and type 2 diabetes. That is diabetes mellitus. That is due to insulin either not being produced by the pancreas or being produced but not being able to enter the cells to be used. Our next term, diabetic nephropathy. This is any disease that arises from having diabetes that will damage the kidneys. But the underlying cause here is having diabetes and not treating it correctly. And that leads to damage of the kidneys. And that's related to our next term, diabetic retinopathy. This is a complication of having diabetes that damages the retina of the eyes. And again, the underlying cause is having diabetes first. See our next term, endocrinopathy. This is a general term that applies to a disease of an endocrine gland. See our next one, hyperadrenalism. This is where you have an excessive production of hormones from the adrenal gland. And the opposite of that would be hypoadrenalism, where you have a very low amount of hormones produced by the adrenals. A very common example of this condition would be Addison's disease. This is due to the very low levels of cortisol being produced, or by producing too little aldosterone also. Hypercalcemia. This is a condition of the blood where your levels of calcium are way too high. And this is due to the overproduction of parathyroid hormone, or PTH. And the opposite of that would be hypocalcemia, where levels of blood calcium are too low. Another term for that condition would be calcipenia. Now there has to be a balance of the levels of blood calcium in the body. You don't want levels to be too high, you don't want levels to be too low. There has to be a balance, and that's controlled by the hormones calcitonin and parathyroid hormone. And when one of those hormones gets underproduced or overproduced, it's going to tilt the scales either to having hypercalcemia or hypocalcemia. Now it's the same thing with our next two terms, hyperglycemia and hypoglycemia. Both of these are reference to the levels of blood sugar. Hyperglycemia is having an abnormally high level of blood sugar. Then hypoglycemia would be having too low a level of blood sugar. So in either case, bad things can happen. You don't want your blood sugar to be too high. You don't want blood sugar to be too low. There has to be a stable balance between the two. Right, the same thing with our next two terms. Hyperparathyroidism, where there's an excess amount of hormones from the parathyroid being produced. Then the opposite of that would be hypoparathyroidism, where you have an abnormally low amount of hormones produced by the parathyroid gland. Hyperthyroidism, an overproduction of hormones from the thyroid gland. And the most common example of hyperthyroidism is Graves' disease. Some indicators of this would be having bulging eyes and having a swelling in the neck. And another term for hyperthyroidism is thyrotoxicosis. So that term basically breaks down to having a toxic level of thyroid hormones in the blood. The opposite of that would be hypothyroidism, where you have an abnormally low amount of hormones produced by the thyroid gland. A very common example of this would be Hashimoto's disease. Now, this is an autoimmune condition. Your immune system is attacking your own thyroid gland. Alright, this image we have an example of someone with hypothyroidism. And some common symptoms that you'll see. The hair becomes very dry and brittle. There's a very sensitive sensation of coldness. The skin becomes very scaly and dry. There's a very irregular pattern of menses in females. The tongue becomes thicker. The voice becomes deeper. So there are any number of symptoms that will indicate hypothyroidism. This is our next condition, myxedemia. This is a swelling of the skin that gives the skin a very waxy appearance. And this is caused by a underactive thyroid gland. So this is a symptom of hypothyroidism. And the next term here, hypogonadism. This is the abnormally low production of hormones produced by the gonads, FSH and LH for example, but this applies to any hormone made by the gonads. Pancreatitis is the inflammation of the pancreas. See our next term, pituitary dwarfism. This is where the growth of an individual is either slowed or delayed due to the underproduction of hormones from the pituitary gland. So this is affecting the amount of growth hormone that is secreted by the pituitary gland. And the opposite of that would be our next term, pituitary gigantism, where there is a overproduction of growth hormone by the pituitary gland. So the growth of an individual is accelerated. And our last term here, thyroiditis, this is inflammation of the thyroid gland. Alright, now we'll talk about some treatments, procedures, and devices of the endocrine system. We'll talk about some common word parts. Prefixes. Endo means inside. Para means local or alongside or nearby. Adreno is a reference to the adrenal glands. Crino is a secretion. Thyro or thyroido, both are reference to the thyroid gland. Some common suffixes. The first one, al, means pertaining to. Ectomy, the surgical removal of. Logi is the study of. Logist is a specialist. Oma is a tumor. And tomi means to cut. Alright, now we'll talk about some specific treatments and procedures and devices. See our first one, adrenalectomy. This is the surgical removal of the adrenal glands. Endocrinology is the field of medicine that specializes in the study of the hormones and endocrine glands. And a person that specializes in this field would be an endocrinologist. The FBS, fasting blood sugar. This is a type of blood test that will check your levels of blood sugar after you haven't eaten for 8 hours or more. And the reason why this is important, you want to get a baseline of where your blood sugar levels are normally. And if you check your blood sugar right after you eat a candy bar, it's going to be abnormally high. That doesn't give you any valid information. So if you don't eat for 8 hours or more, you'll get a better idea of where your blood sugar levels normally are, without the introduction of food altering that value. Opposite of that would be our next term, PPBS, postprandial blood sugar. This is testing your blood sugar after you've eaten. And another type of blood sugar test is our last term, GTT, a glucose tolerance test. This is a longer type of blood sugar test, and it will test for how well your body is able to break down glucose. So you are given a sugary drink, and then levels of blood sugar are taken for a certain amount of time after you've taken that drink. This is to see how the levels of blood sugar go down over time. So our next term, HRT, hormone replacement therapy. This is usually a reference to women who are postmenopausal, whose bodies don't make certain hormones anymore. So since your body doesn't make them, and they're still important for them metabolically, you are taking them artificially. So you are replacing hormones that would normally be there. Parathyroidectomy is the surgical removal of the parathyroid glands. And our last term here, parathyroidoma. This is having a tumor within the parathyroid gland. RAIU, radioactive iodine uptake. This is a radiologic test that will evaluate the thyroid function and how well the thyroid gland actually uses iodine. That's related to our next term, radioiodine therapy. This is a treatment used for correcting hyperthyroidism. In hyperthyroidism, there's too much thyroid hormone being made, so being exposed to radioactive iodine will destroy those cells. And once those cells are destroyed, the levels of thyroid hormone go down because there's less cells present to make that hormone. And our next term here, thyroid scan. This is a nuclear medicine test that will check the function of the thyroid gland after the injection of radioactive iodine. Thyroidectomy, surgical removal of the thyroid gland. Thyroidotomy, cutting into a thyroid gland. Thyroparathyroidectomy is the surgical removal of the thyroid gland and also the parathyroid glands. Thyroxine test. These are tests that are used to evaluate the levels of T4 within the body, which is a hormone produced by the thyroid gland. The point of the thyroxine test is to check for function of the thyroid gland. Right, now go over some common abbreviations for the system. ACTH stands for adrenocorticotropic hormone. ADH, antidiuretic hormone. DI, diabetes insipidus. DM, diabetes mellitus. FBS, fasting blood sugar. FSH, follicle stimulating hormone. GH, growth hormone. GTT, glucose tolerance test. HRT, hormone replacement therapy. LH, luteinizing hormone. PPBS, postprandial blood sugar. PTH, parathyroid hormone. RAIU, radioactive iodine uptake. And TSH, thyroid stimulating hormone. Okay, we will end this chapter and end our video series on medical terminology with our combining form quiz. Terms on the left, crino, acro, adeno, dipso, adreno will match up with either adrenal gland, thirst, extremity, to secrete, and gland. The first one, crino, goes to secrete. Acro goes to extremity. Adeno goes to gland. Dipso goes to thirst. And adreno goes to the adrenal glands. And here are all 5 of the terms correctly match their definition. Alright, that brings us to the end of chapter number 15 on the endocrine system, and also to the end of the video series on medical terminology. I hope you've enjoyed it. I hope you feel like you've learned something, and thank you for watching.